Welcome to Apaga University. I'm Inga.
And I'm Julie. We are two
momtrepreneurs
who have built an in-home care business from the ground up, guided every step of the way by God's care and fueled by agape love.
16 years later and over 100 podcast episodes already under our belts, we invite you to continue on this journey with us as we share stories that resonate, insights that inspire, and practical guidance that empowers you to face any obstacle along this path.
Whether you're a professional caregiver, a family member, or are simply curious about what your steps will be when you need them, you have come to the right place.
Oh, hey, and while you're here, make sure you hit that subscribe button.
And after that, make sure you send this to a friend.
Yes, do it. All right, we'll quit fooling around and get to it.
Let's go. Class is in session.
Hello, Sunshines, and hello, Julie. How are you today?
I am well, Inga Lou. How are you?
It's a great day.
Yeah?
I can't. I've got a major headache, so
yeah.
If I'm off my game, you just know that.
Oh.
That's my excuse for the day.
That stinks.
How are you?
I'm good.
What about that snow yesterday?
Yeah, that was bad.
Do you believe it?
Well, I had all of my hoses to do all my waters and stuff. They all froze.
Yep.
So thankfully, none of the cows really needed water yesterday. They're going to be really thirsty by the time I get home tonight.
Right.
But I had to crank them all up, put them in the house. We have a little spot right when you walk in that keeps it thawed. And I was like, I'm not ready to fight with the hose all winter.
Yeah. No, I have a husband who in the 90-degree weather will drain the hoses just in case it freezes.
Oh,
so unless it doesn't get drained right, which occasionally me and Bailey screwed up, but yeah.
Oh,
but I understand that because it is a very bad thing when the hose freezes.
Yeah, I tiptoed around to all of the different waters, and I was like, oh, thank God you don't need any till tomorrow.
Yes.
Because I was going to be, I was like, oh, I guess you can eat some snow. You can rough it for one night.
You're not going to. You talk a big game, which actually my good news story when we get there, I've got things to tattle about you.
Oh, don't you dare.
Yes. Well, the verse for today is Proverbs 16:24. It says, gracious words are a honeycomb, sweet to the soul and healing to the bones.
That's a nice
Isn't
one.
that nice?
It is.
Is that telling us to say nice things more often?
It really is. It's kind of what's wrong with the world.
It's really bad what's wrong with the world.
We're all not very kind anymore.
Mm-hmm.
Yes.
Well, we'll work on that.
Yep.
I will start right now.
Right now.
Julie, you look beautiful today.
Why, thank you very much.
Yes. Do you want to tell me your story or do you want me to tell you mine?
Well, no. Do it because I'm on the edge of my seat waiting to see what you're going to say.
Well, so I'll start with my story and then I'll tell you why this one hit me in relation to our particular office situation.
Okay.
So my story is actually about a man who builds a special bond with a fox that he rescued. And this little fox now hugs him every day.
I almost picked this story.
Isn't it great?
You are
so 74-year-old
weird.
man has built an incredibly friendly relationship with a fox that he rescued, and she just wants to cuddle with him every day now. This is Jeff Grucock and his fox named Sweep. The cub was brought into a wildlife sanctuary 7 years ago in a very ill state. Jeff says that he believes that she had been poisoned.
Oh.
He spent the next year nursing her back to health, and then he named her Sweep. And unfortunately or fortunately, as a result of that, she imprinted on him and was unable to be returned to the wild.
Uh-oh.
So now she spends her life with a variety of wildlife that are being rehabilitated at the sanctuary. Sweep is such a lovely, friendly fox, says Jeff. And this is in England, by the way. Most people can give her a stroke, but she is definitely closest to me and insists on having a hug every day. I think it's her way of saying thank you for all the looking after we do for her.
Oh.
Although she's healthy now, when the pair first met, Sweep was in rough shape, and Jeff had doubts whether she would even survive.
Oh.
When we first got her, we didn't think there was much hope. She was so lethargic and ill that I had to bottle feed her for months and was up at night injecting her with saline. Must be to keep her hydrated,
Good
I would think.
Lord.
Yeah. Anyway, so luckily after the medication and some good TLC, she pulled through, and here she is 7 years later. It's just crazy to me. So there is a video that we'll put in the show notes of it. And this one hit me because we have a story here at the office of a little orange female kitten named Clementine. So I don't know how long ago it was. What, 2 or 3 weeks ago?
Not been very long.
Some. I think Molly first discovered her little tiny itty bitty scrawny feral cat. And we do get them here occasionally, little alley cats. But this one she was so sweet, and poor little baby had gotten part of her toe ripped, or actually an entire toe ripped off. So she was dealing with that, but it was healing up well. So of course, Molly and I schemed, and I went to the grocery store and got a whole bunch of food. And Molly just worked so hard to build trust with her. And now, little kitten, she's here every morning just screaming at us for her breakfast and her dinner. And then over the weekend, Molly comes and feeds her a couple times a day. And you're not supposed to know this, but we bought her a heated cat house because she will have to remain an outdoor cat. And she does have shelter right now with a cold storage shed that we have out back, but the little heated cat house. So this comes around because we have a client that we work with who oftentimes rehabilitates like wild animals, and she rehabbed a raccoon who also has a heated cat house. And you, Julie, tried to pretend like you were shocked and appalled that we would do this for an animal, but we all know better. And she called you out. She's like, listen here, you are a fellow animal lover, so don't even try to pretend.
Oh my goodness.
Like this is a bad idea.
Oh, I don't even understand.
You do too.
Oh my
little
word.
miss.
All I've got to say is if any stinking animal happens to come to 40 Appleway, they have won the freaking lottery.
I know. I know. Little kitten. She's hanging around, and she must be fighting off the other cats or something, because I occasionally randomly I will see another cat, but she's not left. That's what I was worried about. If we start feeding her and taking care of her, that a bunch of them are going to show up.
We'll see what she does with the stupid house.
With her little heated house. Now, I will tell you who is very pissed off about it is Tuna.
Oh.
So Tuna sits inside the office looking out the window, boxing with her, and just screams and yells.
She just doesn't like
dare
little
shows her
cute
face.
kitty.
Yeah, no, I was actually terrified the other day. I thought there was an actual cat fight happening inside the house.
Nope.
And it was just Tuna fighting with a innocent little cat that had no idea.
Through the window.
She has no idea that Tuna wants to kill her. Not a clue at all.
Tuna has been spoiled and doesn't like sharing.
Yes, she does not. She's like, no, I am the queen of this castle, and there will be no other cats. So anyway. Yep. So little Clementine here at Apaga.
We'll have to see if she does use the stupid house.
Oh, she will use it.
But let's figure this out. How much electricity is that stupid little house going to take?
We're not poor, Julie. We're not poor. We can afford to heat the little cat house so that Clementine can be safe through the winter. Just Alyssa, give me a thumbs down.
Alyssa's giving me this. Just don't go there, Julie. You're not going to win. Oh, fine. Let me tell you my story. It's not about a cute little orange cat. So, this guy went to a wedding 9 days prior to the family wedding. Unfortunately, his father had passed.
Aww.
And on the way to the wedding, he actually picked up the urn with his dad's ashes. Well, he goes to the wedding, parks in the garage. Somebody steals his truck.
Oh, no.
Yeah. And he's not as worried about the truck. He's worried about his dad.
Yeah,
he's
absolutely.
like, my dad was in there. So anyway, they did end up finding the truck. What they did is once they found it, they did see that it had been ransacked. But the stuff that was left was the ashes, along with many of his dad's documents and scale models of some of the planes he worked on as an engineer.
Oh my gosh.
So anyway, they were able to be rectified by that.
Oh.
But anyway, what he said is we got some pretty interesting stuff for his eulogy about all of the fantastic things he did in his life, all of the adventures. And even after he passed away, he had one more adventure in store.
Isn't that funny? I think some people are that's just what happens in their life. They're just adventure happens. I'm very glad he got his dad back.
Yeah,
that would be the worst.
Well, can you imagine as a thief and you go, "What's this?" Oh. Dang it. Sorry, Jim.
Yeah, I don't even.
But he must have had a heart, because if he was heartless, he would have done something stupid.
Yeah.
Yeah, but that he left all the documents and all the stuff that was most important. So that means that even a thief can sometimes find it in his heart
to do somewhat of the right thing.
Yes, somewhat of the right to rectify something they're doing wrong. Part of it. Yeah.
Okay.
Yeah.
Well, Superbugs.
Super duper.
Yeah. Oh, wait. Before we get to that,
What?
if you have stories or verses or good news stories, topics that you want us to talk about, if you don't provide topics for us, you get what we give you. So,
And you don't throw a fit.
email those to julie@ipagahomecare.com or inga@ipagahomecare.com.
Yep. So we are talking about the super duper bugs today. They're not good. As super as in bad.
Yeah.
Not super awesome, super bad bugs.
Yeah.
And basically, the reason I'm doing that is we just a week ago had a client that ended up with one of the bugs we're going to talk about. And it's very contagious. And so I just thought, you know what? We just need to remind everybody that even if you go to the grocery store or you see somebody, these cute little people that you just want to hug and stuff, just assume that everybody has a cootie.
Right.
And it's just better to protect yourself. And the easiest way to ever protect yourself is soap and water. And then also I have a little thing of hand sanitizer in my truck that anytime I go into a store, even to touch the doors, you know, you just know that we all are nasty people.
Yeah.
We all have bad habits and we're gross. And, if somebody has ick, you know, it's cold and flu season.
And it's there. That stuff is out there. So you can't see it. But the second I don't know, haven't we heard stories about people that haven't even left their house and they get sick?
Yeah.
It's like that stuff is floating around.
Oh, yeah. And then what's so funny is when you get a cold or you get the flu or whatever, and you're like, you gave it to me. I saw your nose was dripping the other day. Right. And it's just like, dude.
That's one of my pet peeves, honestly. I get very irritated about that type of an attitude. Like, well, you got me sick. You know what? We really don't know. No. We have no idea. There is so much ick out there.
And we're actually causing some of that by using too much of the germ killing stuff.
Right.
You know, what do they say? When I was a kid, I went out and I played in the dirt. I ate the dirt. I drank from the hose.
Yeah. Built my immunity.
Right.
Yeah.
Right.
Yeah.
And so anyway, we're just going to kind of explain what a superbug is.
Okay. Yeah. So basically this particular explanation comes from Dr. Pritish K. Tosh. And I believe you got this information from Mayo.
Yes.
Right?
Mayo Clinic.
So a superbug may be bacteria, viruses, parasites, or fungi. Superbugs can't be stopped by medicines that are the first choice for treating diseases that germs cause. Superbug infections can lead to higher rates of death from otherwise treatable diseases. So talk to me about bacterias, like examples of superbugs.
Okay. Strains of bacteria, infection from some of the strains of the bacteria that cause hard to treat urinary tract, bloodstream, or wound infections. There is a ton of really big words here. It's all in the show notes, but there's a bacteria that causes sexually transmitted type things, and staph infections with methicillin resistance, staphylococcus, which is MRSA, MRSA. We're going to actually specifically talk about that bug. Can lead to surgery complications, pneumonia, or bloodstream infections. And then you talk about the human immunodeficiency virus, which is HIV, and that don't respond to medicines that can lead to complications or higher rates of death. Then we have some kind of gross parasite.
Plasmodium
that causes malaria, and that causes serious illness and wider spread of the disease. And then there's a Candida fungus, that's linked to bloodstream infections in people who are already sick. So there's some icky stuff out there.
They're pretty mean.
Yeah, really, really mean. They're not even nice. They don't even try.
The thing is that they're medicine resistant, right? So to treat the disease that caused by a germ, healthcare professionals prescribe a medicine that will block the germ. This gives the immune system time to clear the germ out of the body. But if the germ changes so that it survives the medicine, that germ is called drug resistant. It's also referred to as antimicrobial resistant. A germ's resistance to treatment makes it a superbug. It happens naturally, and while resistance can be slowed, it can't be stopped. Once a germ is resistant to the first choice medicine, other medicines have to be used. These can cause worse side effects, not work as well, or be more expensive than the first choice. So, I mean, I think about like when you get an antibiotic and they say, take it all the way, even if you start feeling better, because if you stop halfway through because you feel better, but not everything's dead, it comes back and worse, right?
It's like this stuff mutates and it's just getting meaner and tougher all of the time. And so we're having to try bigger stuff, and that screws with your stomach and all of that.
Everything.
But it's just not great.
So you want to slow the resistance and protect yourself. The best way you can slow down the creation of new superbugs is to prevent infections. You can protect yourself from infections. Like you had said, wash your hands well and often with soap and water for at least 20 seconds. I cannot, when I go into a public place, whether restaurant, movie theater, I cannot tell you the number of grown women that either walk out without washing their hands or just like, they'll just wash the tips of their thing, just run a little water under it. And I'm like, wash your damn hands, please, for the love of God, wash your hands, because you're going to go out in the world and touch things that I'm going to end up coming into contact with. Yeah, I'm the weirdo that like takes the paper towel and shuts off the sink with, opens the door.
You're supposed to do that.
Yeah.
Yeah.
And people look at you like you're a weirdo when you leave the water running to get the, But I don't care. I'm like, I don't want grody germs. So wash your hands well and often for at least 60 seconds. If soap and water aren't handy, use an alcohol-based hand sanitizer with at least 60%. You are awesome about that, Julie, and I've learned that from you. I now too have hand sanitizer in the truck. And you've, from the time I've known you, you've always done that, even before COVID.
Yeah.
You always have hand sanitizer.
I don't know why. There's times I'll go somewhere and like even grabbing some bread from the store. You don't know how many people grab that bread.
Yes, that particular bag.
And so I just and what's gross is actually when you're in the grocery store and you're using the cart.
Yeah.
Because touching that cart, I mean, how many people have you ever seen a baby sitting there and then it stops, it puts its mouth down on it and it's gumming. It's because it feels so good on their mouth and you're just like,
oh, the dirt of the world is what my grandma Fisher would call it.
Get the shits.
Yes. Dirt of the world.
Poor little baby.
You want to handle food with care. This includes washing your fruits and vegetables and disinfecting kitchen utensils such as cutting boards and knives.
So when you don't wash, like your watermelon and all that, anything on the outside, when you cut through, you've put it into the inside.
Yes.
So.
And people don't think about that.
No.
What's a clean knife? Right? Oh, yeah. Okay. Lower your risk of getting an STD. Yeah. So be careful. We can't have too much of a talk about that because we're very shy on this show.
Yeah.
But
don't sleep around, people.
Don't sleep around. Keep your distance. If possible, avoid close contact with people who are sick or have symptoms of illness. Get recommended vaccines. Stay up to date on your routine vaccines and ones that you may need if you travel or when you start new activities. And then take the right medicines at the right time, like we were talking about earlier. Some medicines offer short-term protection from certain germs. For example, taking an anti-parasitic medicine might keep you from getting malaria if you travel or live in a high-risk area. Right.
Well, so this is the deal. I watch a lot of National Geographic and that documentaries and stuff. And every place that is so beautiful to you, oh my gosh, they're on my bucket list. But they will have little goobers that swim. So like if you go in the ocean, it could attack you. Bugs.
I know.
I mean, it is scary out there. And let's say it's one in bazillion that it happens to, but it happens. So I'm just like, do I ever want to really, really travel, even though that looks incredibly beautiful?
It's weird because you get used to your own things, right? You get used to. So I'm like, I will live in Montana where it's cold because we don't have, I mean, we do have rattlesnakes and everything, but we don't have a lot of those like yucky snakes and bugs and roaches and tarantulas and scorpions and all that stuff, right? But, I'll take the bears. I'll take the mountain lions. I'll take all of these things, right? And other people are like, oh, my God, I could never live in Montana because of this. And, But then wherever you are, whatever you're used to, it's like
it's there.
The people that live in those beautiful places, they probably just know that they have to be aware of it. And But I'm with you. I'm like, swimming in the ocean? Have you seen the ocean? Have you seen what's in the ocean?
I'm afraid of jellyfishes.
Yeah.
I mean, that's a big scary one right there.
Yeah, I think I know somebody that got stung by a jellyfish, and it was not a good time at all. But
ouchie.
Oofda. Anyway, I guess you got to live a little though. Maybe.
Yeah, you should.
Yeah. Okay. So you said we were going to talk about 2 specific superbugs, and that it's in all reality we deal with it in home care.
Yeah.
I wouldn't say all the time, but it happens.
Occasionally stuff happens. And this was a perfect example of a gal that had been in and out of the hospital for the last month, the majority of the time. And that is where some of these bugs come from.
Yeah.
And no matter how careful people are, I mean, you go to a doctor, he's going from patient to patient. The nurse is going from room to room. The CNA's doing the same. Just one person not having perfect hygiene. I mean, even when I had my little stint of working at the hospital, I would watch those housekeepers, and, you know, even the bed rails and the push button. You know, there are little things that, I mean, you got to scour everything down before the next person goes in that room.
So, you know what I'm crazy about? My phone. Like, I constantly am taking Lysol wipes, and I'll wipe all of it down. Because I'm like, think about how many things you touch all the time, and then you pick up your phone and you dial your little numbers or do whatever. And
put it up your face.
So, or like take it out in the barn with you. You're cleaning the barn. So one of our clients, like you were saying, had been in and out of the hospital. And, you know, it just, sadly, that is a place where you can pick some of these things up, and they do the best that they can trying to prevent it, but it does happen. So let's talk about C. diff.
Yeah.
Do you know how to pronounce it?
This little piece of paper says how. Clostridium difficile.
Good enough for me.
Okay. But we'll, from now on, call it C. diff.
Okay, C. diff.
So it's a bacteria that causes an infection of the colon, the largest part of the large intestine. Symptoms can range from diarrhea to life-threatening damage to the colon. So basically, our little woman, every C. diff I've ever seen is when people basically get horrendous diarrhea, and it just never stops. And you get a sample of that and diff. The funny thing is then when you tell people that they have C. diff, people freak out and they don't want to be around them. But they've probably had C. diff for a month prior to finding out that they had C. diff.
They actually had it.
So just because somebody has it now doesn't mean they didn't have it previously. So the proper infectious disease protocols should always be in place.
So listen to this. So basically, this illness from C. diff often occurs after using antibiotic medicines. It mostly affects older adults in hospitals or in long-term care settings. People not in care settings or hospitals can also get it. Some strains of the bacteria that can cause some serious infections are likely to affect younger people. So basically, symptoms often begin within 5 to 10 days after starting an antibiotic, but symptoms can occur as soon as the first day or up to 3 months later.
Oh, wow.
Yeah. Most common symptoms of mild to moderate C. diff: watery diarrhea 3 or more times a day for more than 1 day, and then mild belly cramping and tenderness. Severe infections. So people who have a severe C. diff infection tend to lose too much bodily fluid, a condition called dehydration. They might need to be treated in a hospital for dehydration. C. diff infection can cause the colon to become inflamed. It sometimes can form patches of raw tissue that can bleed or make pus. Symptoms of a severe infection: watery diarrhea as often as 10 to 15 times a day. Oh, poor babies.
Good Lord, your little
bum. Oh, belly cramping and pain, which may be severe, a fast heart rate, loss of fluids, again called dehydration, fever, nausea, increased white blood cell counts, kidney failure, loss of appetite, swollen belly, weight loss, and blood or pus in the stool. So an infection that is severe and sudden can cause the colon to become inflamed and get larger, called toxic megacolon. And it can cause a condition called sepsis, where the body responds to an infection, damaging its own tissues. People who have toxic megacolon or sepsis are admitted to an intensive care unit in the hospital, but toxic megacolon and sepsis aren't common. So it can happen, but it says they're not common in C. diff.
Right.
Yeah.
Right. So basically, when to see the doctor, some people have loose stools during or shortly after antibiotic therapy. This may be caused by the C. diff infection. So if you have 3 or more watery stools a day, symptoms lasting more than 2 days, a new fever, your tummy has pain or cramping, and then blood in the stool.
My tummy's kind of painful and cramping right now just talking about it. Oof.
That's the opposite of what I'm having sympathy for. The other end. Diarrhea is no fun.
No, man.
Cha-cha-cha.
No, thank you. Okay, causes. So C. diff bacteria enter the body through the mouth. They can begin reproducing in the small intestine. When they reach the part of the large intestine called the colon, the bacteria can release toxins that damage tissues. These toxins destroy cells and cause the watery diarrhea. So outside the colon, the bacteria aren't active. They can live for a long time in places such as human or animal feces, surfaces in a room, unwashed hands, soil, water, food, including meats. When the bacteria once again find their way into a person's digestive system, they become active again and cause the infection. Because C. diff can live outside the body, the bacteria spreads easily. Not washing hands or cleaning well make it easy to spread the bacteria. Some people carry C. diff bacteria in their intestines, but never actually get sick from it. These people are just considered carriers of the bacteria, and they can spread infections without being sick.
That's the
I'd always heard that.
Yep, that's the scariest thing.
Yeah, you might
me.
have it and not know it.
Yeah.
And so when you don't,
And there's more than a lot of things that we can carry without knowing.
Yeah.
And show symptoms or any of that.
So even if you're not sick, wash your hands.
Yeah,
always. Take good care.
Yeah.
Good hygiene.
Yep.
Risk factors. People who have no known risk factors, they've gotten sick from it, but certain factors do increase it. So taking antibiotics or other medicines. Intestines house a wide range of bacteria. Many of them help protect the body from infection. Antibiotics that treat an infection tend to destroy some of the helpful bacteria in the body, as well as the bacteria causing the infection. That's what I was like trying to figure out, like, why do you get it after you've been on antibiotics? Well, because the good bacteria gets killed as well.
Yeah.
Yeah. And then staying in a healthcare setting. So most C. diff infections occur in people who are in or have recently been in healthcare settings, hospitals, nursing homes, long-term care. They're places where the germs just spread easily, and antibiotic use is common, and people's health put them at risk of getting an infection. So basically, again, it's going to spread on hands, cart handles, bed rails, bedside tables, toilets, sinks, stethoscopes, thermometers, medical tools, even phones, remote controls.
Yeah.
Yeah.
Yeah. What did they say? Even when they clean or they do inspections on hotel rooms, one of the things that is the grossest thing in there is the TV control.
Oh, I'm sure.
Yeah.
Yeah, I love what Lysol wipes. I'm wiping down all that stuff. Ugh, grody.
Yeah.
Having a serious illness or a medical procedure. So certain medical conditions or procedures can up the risk of getting C. diff. Inflammatory bowel disease, weakened immune system from a medical condition or a treatment such as chemotherapy, chronic kidney disease, procedures on the digestive tract, and then other surgery of the stomach area. And then older age is a risk factor. In one study, the risk of becoming infected with C. diff was 10 times greater for people aged 65 and older compared to younger people.
Oh.
And then sadly, having it once increases the chance of having another one.
It's probably
infection.
just in your system then, dormant.
Probably, yeah.
And then something triggers it and you're off to the races again.
Yep.
Yeah. So complications, everything from dehydration, different things failing like your kidneys, bowel perforation to death. So it's something that you do not or cannot ignore.
Yeah. Biggest prevention is the biggest thing. So hand washing, just contact precautions. So, if you know somebody has it, be cautious in how you're dealing with that. And really in our world, it's using universal precautions all the time anyways.
Always.
Yeah.
Anyway.
Yep. And then thorough cleaning.
Yeah. Yeah. So, and that's one thing that we have here if people need it. We have gloves, we have masks, we have
gowns,
we've got sanitizer.
Yep.
We've got those things because it's not weird to have something like this happen.
Sure.
You just have to be prepared. What's interesting is people's attitudes about it, because honestly, the next one we're going to talk about just now is MRSA, that really nasty bug. One time we had a gentleman leave the hospital. He was new to us. We had been with him about 3 days when the hospital called me and goes, "Oh, and by the way, we just found out that he tested positive for MRSA." And I was like, "Oh, fantastic." Because then I needed to go back on the schedule for the 3 days, see who had been there, call them up and let them know this guy has MRSA because it's highly contagious. Well, thankfully, the people that had been in there, there'd been 2 different people. They were all so good about it, going, "Oh yeah, I wash my hands. I'm not scared of it at all because I do the right things all the time." Yep. And so I was thankful for that.
Yeah. Yeah, and you train that when we hire new people.
Yeah,
That's just part of it. Use those universal precautions.
And just it boils down to everybody's got a cootie of some sort.
Yeah.
They really do.
Yep.
So
MRSA, how do you say it?
MRSA. Methicillin-resistant Staphylococcus aureus infection. Ew. Is caused by a type of staph bacteria that becomes resistant to many of the antibiotics used to treat ordinary staph infections. Because you hear about staph infections all the time.
Yep.
So it's, once again, occurs in people who've been in the hospital or other healthcare settings, such as nursing homes and dialysis centers. And so basically we got to make sure that we are ultra careful in those scenarios. It's spread by touching people with unclean hands or people touching unclean surfaces, very much like the C. diff. And then there's also a community-associated MRSA, which can begin as like a painful skin boil. It's usually spread by skin-to-skin contact. At-risk populations include high school wrestlers, child care workers, and people who live in crowded conditions. So anyway, the one thing about staph is it can be in your bloodstream. It can be like in your nose. We've had people that just had it in their nose. And then, or you can see somebody with a big old owie and it's pussing up and it's red and it's got staph. So, just there, it's not always visible to the eye.
Right.
Yeah.
Oof.
So, yeah.
You can see how these things get out of control
very quickly. Yeah.
Staph skin infections, including MRSA, generally start as swollen, painful red bumps that might look like pimples or spider bites. The area might be warm to the touch, full of pus or other drainage, and also accompanied by a fever. Again, they usually start out as that small red bump, and then it quickly turns into like a deep, painful abscess. Oof. No, thank you.
Yeah.
Some of them require surgical draining. Sometimes the bacteria remain confined to the skin, but they can also burrow deep into the body, causing potential life-threatening infections in bones, joints, surgical wounds, bloodstream, heart valves, and lungs. So it is really not anything to mess around with.
No. You know what? When you get like that, you're like, oh, is this an ingrown hair?
Right.
Or is this a spider bite? But if you start getting warmth and heat and a big red, quite often what the smart thing to do is kind of circle that with a pen.
Yep.
And then watch to see if it grows.
Yep.
But monitor it, because that could be something that is definitely the opposite of what you were thinking.
Yeah. So that is a really great piece of advice, so that you put that circle around it and then you can watch it. And if it's getting bigger, then maybe it's time to consult with a physician.
Yeah.
And especially if it's accompanied by a fever.
Oh yeah.
That's a big thing too. So keep that in mind. So causes, basically staph are normally found on the skin and in the nose of about 1/3 of the population. The bacteria are generally harmless unless they enter the body through a cut or a wound. And even then, they usually only cause minor skin problems in healthy people.
Right.
But MRSA is the result of decades of often unnecessary antibiotic use. For years, antibiotics have been prescribed for colds, flu, and other viral infections that don't respond to the drugs. So even when antibiotics are used appropriately, they contribute to the rise of drug-resistant bacteria because they don't destroy every germ that they target. So bacteria live on an evolutionary fast track, so that the germs that survive the treatment with one antibiotic soon learn to resist others. Yeah.
I think there's several things nowadays that, like an ear infection, I don't think that unless it's really bad, they will give you any antibiotics anymore for like an ear infection, because you're building up resistance the more you use stuff.
Yeah, they don't hand it out like they used to at all. And I mean, for good reason, because we're just making more and more and more superbugs, making our superbugs more super.
Meaner and meaner.
Something like that.
Scary.
So talk to me about risk factors for MRSA.
Yeah, basically being hospitalized, where they can attack those most vulnerable, having an invasive medical device, medical tubing, such an IV line or urinary catheters, residing in a long-term care facility. A lot of people are carriers, like we said, even though they're not sick themselves. That's what I've always heard is we all have staph. We all have it. Is it going to be blowing into something? So
same too. Because I didn't know a lot about MRSA. I didn't know anything about MRSA when we first started this business. And I recall, early on there was a gentleman that we were serving that had MRSA, and I was freaked out by it. But I talked to a doctor and he was like, "Listen, we've all got it, right? So it's just you just have to be safe about what you're doing,
trying to prevent it any worse." So the community MRSA, participating in contact sports, and that can spread through cuts and scrapes and skin-to-skin contact. I think anytime something happens, just get out the old hydrogen and just try to get it clean as soon as possible. Living in crowded or unsanitary conditions, the military training camps, child care centers, and jails. Having an HIV infection, and also using illicit injection drugs.
So complications that you might experience, basically so MRSA infections may affect your bloodstream, lungs, heart, bones, and joints.
And so to prevent, just wear protective garments. You have to follow strict hand hygiene procedures. Once again, wash your hands with soap and water or using hand sanitizer before and after each clinical appointment. Hospital rooms, surfaces, and equipment, as well as their laundry. The stuff that they're wearing can also have the cooties. So gloves. We buy big cases of gloves all the time because we have them here for people, and we always give them a box or however many they think they need, especially if you're toileting somebody. You just have to be smart. I remember when I was working in the ER or in the hospital in general, anytime we would clean a room, you just put on gloves. Just have them in your pocket because you never know what's going to go on. But then use your head, because if then you use gloves to use your phone.
I've seen people do some dumb stuff with gloves.
Yes. And sometimes it's like, well, I think you're actually making it worse.
Like if you still, like if you put the glove on, but then you like pick your nose and with the glove, you're still putting that in, like, you still have to use your head about that. And it doesn't always get done.
No. And then when you take off gloves, you can't just grab them. And then grab it with your clean hands. You're supposed to pull them and inside out them. But
that's very satisfying to me. Inside outing a glove when you take it off. I don't know why, but
the job is done. I have done my job. Wash your hands, careful hand washing. Like I said, we've said it 1,000 times. I think that's the big takeaway here. Remains your best defense against germs. Scrub hands briskly for 20 seconds. I always heard, happy birthday to you. Happy birthday to me. Anyway, carry a small bottle of hand sanitizer containing at least 60% alcohol at times. Keeping wounds covered, cuts and scrapes, keep them clean and covered with clean, dry bandages until they heal. The pus that the injury might have could contain that MRSA. And then keep personal items personal. Avoid sharing personal items such as towels, sheets, razors, clothing, and athletic equipment. MRSA spreads on infected objects as well through direct contact. Shower after athletic games or practices. Shower immediately after each game or practice. Use soap and water. Don't share towels. And then sanitize your linens. If you have a cut or a sore, wash the bed and linens and towels in a washing machine set to the hottest water setting with added bleach if possible, and dry them in a hot dryer. Wash gym and athletic clothes after each wearing.
Each wearing?
Wowzer.
I think there are some
people that don't go
middle
all
school
year.
gym uniforms that never get washed all year long.
Ew.
Yikes.
See, that's how easy it is.
Yeah.
I mean, I remember as my mother would do it, and then as I would do it to my kids, bring your gym stuff home. It's got to be disgusting.
Yes.
And now we know why, besides the smell.
Yeah.
There could be bigger cooties.
100%. Oofda.
Every day, it's just a wonder that we make it through another one.
It's true. I mean, just think about everything you touch all day long and all of the germs that are there. So
all of them.
Be smart. Be safe. Wash your hands. Use your sanitizer.
Yep. So Inga, actually, this week you have the old phrase.
Yes. So I have a friend, acquaintance that I end up texting with, probably every day. But I oftentimes have to say like, hey, I'm super busy today, or I've got these things going on or whatever, just so she knows if she doesn't hear from me. Mm-hmm. So anyway, I have been really just very in depth with projects lately. And so I was like, hey, I got to go head down, butt up. Like, I'm not going to be able to talk to you for a while. And then after a couple of days of saying that, cause then she would, are you head down, butt up today? And then I was like, where did that even come from? Right. And am I using this correctly? And then I was like, well, I don't know if I can look that up on the internet, because I don't know what's going to show up if you say head down, butt up. Anyway, I took the risk and, I just went ahead because I wanted to make sure I wasn't saying something that was like crazy. And it is just basically like working hard at something.
Oh, funny.
Yeah. So
yeah,
that's when I'm super concentrating on something, or I've always said it to my kids, like, hey, we got to go head down, butt up this weekend. We've got a lot to do.
Right.
I don't know. Anyway, it's
that's
a thing.
Awesome.
It means to work hard.
Yeah. Well, there you go.
So, and then my friend said, did you wear head down, butt up for your Halloween costume? It's like, I didn't, but that's kind of funny.
What would you do? Put a picture of your head,
your
face on your butt, and then
I'm not sure.
That's hilarious.
Anyway, it was just me working hard at something. That was my costume. So maybe I did wear that for Halloween. Anyway.
Oh, that's awesome.
Okay.
All right. That's it.
Peace out, Girl Scouts.
Yeah. Have a good day.
The Caregiven name is a registered trademark of the Veritrust Health Incorporated Company. IPAGA is not connected to, affiliated with, or endorsed by Veritrust or any of its affiliates.